What we do know, the 2 cases that have so far been diagnosed in Australia, and there may be more, but at the moment 2, both young people, both from South Africa, both fully vaccinated, asymptomatic. That's just 2 people. We know in Hong Kong, two cases there, young people, a transmission in hotel quarantine from one person to the other, young, fully vaccinated, asymptomatic. So we need to see whether that is actually the characteristic of this virus. Of course, if it is, that's very reassuring, but it's too early to definitely say that. The third one is about vaccine effectiveness and treatment effectiveness, and the Minister mentioned he'd spoken with the CEOs of our 2 major suppliers of vaccine at the moment, Moderna and Pfizer. Both of those companies have put out public statements over the weekend saying that they are onto this. They know that they can change, and this is one of the other major advances in the last 2 years. We did not have vaccines. We did not have proven mRNA technology. We have both of those now. We have contracts with those companies. They are already starting on considering what they would do as a specific vaccine if it is needed. At the moment, we have no definite evidence, either clinical or laboratory or at the population level, that the vaccines are less effective against this virus. We have no evidence of that. And Pfizer and Moderna can move quickly, if that was to come to pass, to make a specific vaccine. That's a major advantage. GSK that supplies sotrovimab, which is one of our treatments that is now being used and pre-purchased in Australia, being supplied from the National Medical Stockpile. GSK report that they designed that antibody, that specific antibody, for exactly this purpose. So it would cover more than what was circulating at the time. So they're confident that will not be affected, but they'll continue to look at that over time. Just one other thing before I pass to questions would be, or pass back to the Minister, is that we are very well connected internationally. We're getting information directly from the World Health Organisation, but other countries. Professor Michael Kidd, the Deputy Chief Medical Officer, is in close contact with his South African colleagues in the General Practice Network. Myself and Dr. Sonia Bennett, one of the other deputies, spoke directly with Israel Ministry of Health yesterday and got their thoughts. Very useful and helpful to hear what they were doing. And we have other meetings planned. Through the AHPPC, the TGA and ATAGI, there are international networks working through that to get as much information as we can about this virus as quickly as we can and to answer those 3 crucial questions.